Leo, Sarlene, do you think that we could start?
Of course, take it away.
Yes.
Good morning, everyone. I'm Vasilis Kouranos. I'm a consultant at the Royal Brompton Hospital. Thank you very much for attending this annual from now on symposium for patients with sarcoidosis. This has been a joint decision between us and Sarcoidosis UK to proceed with an annual event that would take place during April, the Sarcoidosis Awareness Month. We had planned this to be earlier this month, but because of the Easter holidays, we had to move the date to today. And I must thank Sarcoidosis UK for all the background preparation for this event. I would just, I have a few slides to show you before I introduce the next few speakers. And I just want to emphasize that this day is all about patient engagement. Our clinics are patient-centered and patient-focused, with huge respect in the communication between the consultants and the patients. We want the patients to be part of the decision-making, and we want to hear your experience. But most importantly, in order to communicate effectively with us, we have to increase your education and understanding of the disease. You are the main ones who are suffering from it, and I understand how difficult this can be on a day-to-day basis. So it is very important for us to exchange ideas and try to engage as much as possible. For that particular reason, we have changed this year's event and asked some of the patients that are participating in the Royal Brompton clinics to co-chair the sessions with our consultants, so that this brings emphasis to the patient's role in this disease journey. We have a very strong and big team, as you can see here. And obviously, Athol Wells is the heart and the soul of this clinic and service. He has managed to establish joint clinics, but also to bring clinicians that are highly specialized in their particular organ involvement to the assessment of patients with sarcoidosis. Elizabeth Rinjoni, Felix Chua, Peter George, Philip Molyneux are consultants at the Royal Brompton Hospital, and we also have Maria Kokos and Professor Gisli Jenkins, who are also helping us in the management of these of sarcoidosis patients. The team would not be the same if we didn't have the clinical nurse specialists and coordinator who are hugely helping with our communication with the patients on a day-to-day basis, as well as their bookings. Professor Anand Devaraj, Professor Desai are helping us hugely from an ILD radiology expertise, and we have a number of, as you can see, clinicians who are involved in different parts of the condition. I'm very happy to have colleagues from across the country who are going to give talks today, and even international speakers to share their experience worldwide. We do have probably one of the largest sarcoidosis clinic in the UK, with loads of patients attending on a regular basis and approximately 500 new referrals per year. And under the guidance of Professor Wells, we have established combined sarcoidosis clinic for neurology, skin disease, cardiac sarcoidosis, and often rheumatology. I want to, before I move on, I want to say particular thanks to Sarcoidosis UK and whatever they are doing, helping us, the Royal Brompton Hospital, with the service delivery, but also always participating in the events for both patients and healthcare professionals. And they should be acknowledged for that. We will talk today about several aspects, including practice guidelines, specific forms of the disease, as well as have a multidisciplinary meeting simulation. And the last part would be about research and how we could increase your engagement with that. Before I move on to hear a few things about Sarcoidosis UK, I want you to hear a few introduction words from Professor Athol Wells, and just to make it more personal for me, he is the reason why I'm in the Royal Brompton Hospital. I came from Greece in 2013 just for him, and I'm very happy to have done many things with him so far in both research and clinical. Athol, over to you.
Thank you, Vasilis. Just 3 quick comments, because I think the programme is very inviting and I really don't want to delay it. I'd like to echo thanks to Sarcoidosis UK. The symposia online have been hugely successful, and they've been successful, I think, because of interactions in ideas between listeners and speakers, which leads me to my next point. Sarcoid UK, you have, with Vasilis, I will come to Vasilis, you have set up a superb forum, and I'd like to appeal to listeners to use the chat liberally. Not all questions will get an answer in the symposium itself, but people will do their best to type in answers to questions. And I can't stress too strongly how valuable ideas have been coming from patients over the years. This has been a huge boon to develop thinking in sarcoidosis. Now, Vasilis, I do have to correct one point. I would say the heart and soul of the Sarcoid team is yourself, and your actions over the last 5 to 7 years have been absolutely inspirational. And I feel I must make that point very strongly. And I'm going to congratulate you in advance on the symposium today. And I do that without my fingers crossed, I can tell you. So I think that really is all I wanted to say at this stage. And so let me pass on now to the first session.
Peter, welcome from as Sarcoidosis UK President. We would like to hear some words from you and then pass on to Leo.
Yes, thank you. Good morning, everyone. Welcome to the Sarcoidosis Patient Day. First of all, I mean, thank you very much for the introductions, both from Vasilis and Athol in sort of mentioning Sarcoidosis UK. Obviously, you know, this I think is an event very much driven by the Royal Brompton and Harefield with our support, but it is very, very much, we're very pleased to be involved in the delivery of the day. First of all, I think to just mention that a number of you will already be aware, but Sarcoidosis UK is the UK's charity for sarcoidosis, and we have 4 main focuses. Obviously, one of our key challenges is raising money, but the focuses for Sarcoidosis UK are to support patients, sufferers, families of sufferers in getting information, in getting support through our nurses, and running support groups. We also are advocates for sarcoidosis sufferers, and particularly over the last 12 months, we have been very active in being in touch with government, other charities and whatever, to make representations on behalf of the sufferers of sarcoidosis. And of course, our primary aim is to commission research and to ultimately find treatments and hopefully a cure for sarcoidosis. And of course, today, the key focus of today is on providing information. And as Vasilis and Athol have already said, there is an amazing panel of experts today who will be able to answer hopefully a huge amount of questions, as Ethel said, maybe not all, but a huge number. So please actively engage, and I'm sure you'll find the day very valuable. Of course, over the last couple of years, particularly during COVID times, it has been a very busy time for Sarcoidosis UK. As you can imagine, going back just nearly 2 years ago, there was a huge amount of concern with people suffering sarcoidosis, not least because obviously COVID very much a respiratory illness, and the vast majority of suffer from respiratory condition, sarcoidosis. So we've had a very busy time. Our key focus probably up until that was focus groups, support groups, and etc. And there was a huge switch for us to move online. And I think we've been very successful at providing a lot more information and resources than ever before. You can imagine the questions coming in from people with regards to the impact on their health, whether they should advice over shielding, mask wearing, vaccines, risk of vaccines, efficacy of vaccines, and we've been working very, very hard to provide that information. So what I thought I'd do is just touch on, 2021 was also a busy year, the second year of COVID, and I thought I'd quickly touch on some of the key achievements, and then maybe talk very quickly about what we're looking for 2022. So as I touched on, research, in 2021 we committed £60,000 with match funding from the British Lung Foundation to further research into causes and a cure of sarcoidosis. In terms of information, like today, this patient day, we ran 4 patient days last year, which got over 10,000 views. We did a number of Q&A videos, as I said, experts on COVID-19, vaccines, and etc. And of course, kept all this information up to date on our website, so people have an online resource. And of course, everything that we do in terms of patient days, videos, and all the rest is all published there for people to see. Support, as you can imagine, our nurses were very busy. We've added a 3rd nurse and took over 500 calls in 2021 with sufferers to help give information and support. We continued our group meetings online. In terms of awareness, we've kept sarcoidosis at the forefront of people's awareness. We've got a huge amount of visitors to the website. We continue to still stuff through the shop. We have a number of people following more than ever on Facebook. We've done things like had a partnership with Bromley FC and Hopkins Racing, and Leo, who will be speaking in a moment, was interviewed on the Sark Fighter podcast. In terms of 2022, well, a lot of it is more of the same. We have new support groups. We continue engagement with medical professionals, and one of our key focuses for this year is to work in partnership with the Royal College of GPs to provide an information and training module to be shared with GPs to increase the information to hand. We continue to develop and update our information leaflets. With regards research, we are now going to set up our own research committee with members of the sarcoidosis and wider clinical community to help advise us and direct and call for new research in the future. So there'll be much more of a focus on research led directly by Sarcoidosis UK. We have new sarcoidosis ambassadors, so people who are representing and speaking for the charity. More patient days we have today, and we'll have others throughout the year. And of course, we keep updating our web pages. And I think to have a closer contact with patients, we are also setting up a new patient advisory board, which we'll be setting up over the next couple of months, and get a greater patient voice, we hope, into the direction of the charity. That's the quick whistle-stop tour of 2021 and 22. I'll now hand you over to Leo to tell you a bit more about Sarcoidosis UK.
Thank you, Peter, and hello everyone. Welcome to our 2022 Sarcoidosis Patient Day. I will just start sharing my screen. So my name is Leo. I'm the Senior Executive here at Sarcoidosis UK. And today I'm going to be talking a little bit about Sarcoidosis UK, who we are, what we do, and how we might be able to support you in your sarcoidosis. Before I do that, I'd like to say a really quick thank you to the Royal Brompton and Harefield hospitals, and particularly Dr Kouranos for working so closely with us on this event. And of course, to all the amazing speakers who are joining us today. So Sarcoidosis UK, we are the UK's sarcoidosis charity, and we have 4 main goals. They are to provide meaningful support, to provide quality information, to raise awareness of sarcoidosis, and to fund research towards a cure. So let's start off by talking about some of the research, some of the support services that we offer. So at Sarcoidosis UK, we know that patients often just don't get the support that they need or deserve. So we provide a range of support services to help support anyone who is affected by sarcoidosis. Our goal is to ensure that anyone who is affected is able to speak to somebody who cares and who understands what they're going through. So one of the ways we do this is through our Sarcoidosis UK support groups network. Now, groups tend to meet every 4 to 6 weeks, and some of them are now meeting in person and others are still meeting using Zoom. So there are both options. And these groups provide an opportunity for you to be listened to by people who understand, to share your experiences of sarcoidosis, and also to learn from other people's experiences as well. So if you are interested in joining a support group, or perhaps even setting up your own support group in your area if there isn't one already, please do get in touch. We would love to hear from you and put you in contact with your local group or have a conversation with you about setting up a new one. Another way that we offer support to sarcoidosis patients is through our online support groups. We have several Facebook groups for different locations in the country and different types of sarcoidosis. And we also have a main Facebook group, which currently has over 6,000 members. And these are very knowledgeable members, very supportive members who offer each other advice, support, and also share their experiences with each other, which can be invaluable. Just a note on privacy in the Facebook groups, they are closed groups, so any information that is shared in there is only visible to the group's members. So please do consider joining those groups, as they are a valuable resource. Finally, we also provide support through the Sarcoidosis UK Nurse Helpline. This helpline started in 2016 and since then has taken over 2,500 calls from patients, and they have taken calls from patients who are affected by sarcoidosis in countless different ways. They really have heard it all. So we have 3 amazing nurses, Jo, Jenny and Rachel. You'll see on the right hand side of my screen here, Rachel, who joined us last year. And they really are experts at providing advice, information and support, as well as that empathetic listening ear. The helpline is completely free to use, so if you would like to schedule a call with one of our nurses, do just give us a call or an email, or you can also submit a ticket through our website to request a call back. Next, I'd like to talk about the information resources that we have. So we know that sarcoidosis can be quite confusing for all patients, but particularly for people who are newly diagnosed. So our goal is to try and reduce this uncertainty as best we can by providing clear, quality and accurate information about sarcoidosis. So all of our patient information is produced with the help of our trusted medical experts, and of course is free for anyone to use. So first of all, our leaflets. We consulted with experts from across the UK to create these patient information leaflets. We have leaflets about the different types of sarcoidosis, as well as some non-organ specific leaflets as well. For example, we have information for employers leaflet that can be given to your employers to kind of explain a bit about sarcoidosis and what it means for you. And so our leaflet's also completely free to download on our website, and you can also request physical copies too, if you prefer, so just get in touch and we'd be happy to send them. Next up, patient days and Q&As. Of course, it's completely normal for patients to have lots of questions about their sarcoidosis, and we do get a lot of them. So we collect all of these questions that we receive and we put them to specialists in our live Q&A videos, all of which are available to watch on our YouTube channel. And we've created loads of these over the last few years on lots of different topics, for example, COVID-19 vaccines, vitamin D, applying for PIP, just to name a few. And our patient days like today are also a fantastic opportunity for patients to learn about their conditions from leading specialists, as well as having sarcoidosis related questions answered as well. So all of our patient days are recorded and available to watch back on our website with full transcripts. So if you do want to look back at some of our previous patient days, if you head to the Patient Days Hub section on our website, you'll see all of our previous days with full transcripts as well. We also know that it can be really difficult to find a sarcoidosis specialist in your area. We've created a sarcoidosis consultant directory, which is available on our website. And as far as I know, it's the only one of its kind in the UK. And you can search for a consultant by location, by name or condition, and also get details for a referral. Okay, let's move on to awareness. So April is Sarcoidosis Awareness Month, as Vasilis mentioned earlier on. So it's really important that we talk about about raising awareness of the condition. So sarcoidosis is a rare disease, and because of that, very people have heard of it, frustratingly. And we absolutely recognise the lack of awareness, both from members of the public and some members of the medical profession too. So it's our mission to change this, and later on this year we will be announcing some exciting work that we are planning to do to raise awareness amongst primary care physicians. And in addition to that, we're also involved in representing sarcoidosis patients through our advocacy work, for example, with the European Lung Foundation, with the Task Force for Lung Health and the British Thoracic Society, with whom we are working on the ILD registry. Our online presence has grown significantly over the last few years as well, and we do try and get the word out there as much as we possibly can. So please do help us out if you are a social media user. Do follow us and do help us by sharing our content and help us get the word out there so it reaches as many people as possible. Finally, just a quick note on our online shop. On our online shop, there's lots of things you can purchase to help raise awareness. We've got badges, hoodies, the lot, and you can also use that online shop to register for events like today. So our fourth aim is to fund research into a cure. I actually won't be covering research in my talk today, not because I don't want to, but because later on in today's event, we'll be hearing from Henry Shelford, who is the Sarcoidosis UK Trustee Chairperson, and he'll be talking a little bit about our past research projects and also our research strategy moving forward as well. So we can look forward to that at about 3:30 p.m. this afternoon. So my last slide before I show a quick video is just a quick note to anyone out there who's watching today to consider supporting Sarcoidosis UK. We would be so grateful for your support. As a small charity, we are so proud of the work that we do. However, we don't receive government funding, and none of our important work would be possible without donations or fundraisers. So if you've benefited from our support services, or you found today's event useful, or you just want to make a donation to a sarcoidosis related cause, please consider going to sarcoidosisuk.org/fundraise to get involved with fundraising for the charity, or go to sarcoidosisuk.org/donate to make a donation. Now I'm going to play you a short video that we've created just so you can meet a few more members of the team and also learn a little bit more about our work. So I will just share my screen.
One of the best parts about being Executive Chairperson here at Sarcoidosis UK is seeing and hearing about the impact our work has on people affected by sarcoidosis. We're the UK's largest sarcoidosis charity with four main goals: to provide support, to provide quality information, to raise awareness of the disease, and to fund world-leading sarcoidosis research.
When it comes to support, having someone to listen and give advice is so important for sarcoidosis patients, their loved ones and their carers. Sarcoidosis UK run a free and confidential nurse helpline for anyone affected by sarcoidosis, and all of the calls are taken by the Sarcoidosis UK nurses.
I was diagnosed with chronic sarcoidosis in 2016 and have worked within the NHS for many years supporting people with long-term health conditions. Now, as a Sarcoidosis UK helpline nurse, I get to use my experience to help others affected by sarcoidosis. Whether you've just been diagnosed or need advice at any stage of your sarcoidosis, we are here to help and really do understand what you are going through.
Sarcoidosis UK also run a network of support groups across the country. Our groups are an opportunity for you to be heard by people who understand what you're going through.
Because sarcoidosis is a rare disease, a lot of people haven't heard of it, which can make those affected by it feel very alone. Having sarcoidosis myself and being part of the Sarcoidosis UK support group network is really fantastic. I see firsthand how it brings people together and offers them a safe space to share their experiences and learn from others.
As well as offering fantastic support, Sarcoidosis UK provide much needed information to patients by hosting Sarcoidosis Patient Days and producing high quality Q&A videos with doctors and specialists. We also have leaflets on the different types of sarcoidosis and a fantastic hub of information on our website, including the Sarcoidosis Consultant Directory, a growing database of known specialists across the UK, designed as a tool for patients and healthcare professionals to help remove this barrier to effective care.
I'm honoured to be working closely with Sarcoidosis UK to help raise awareness of the disease. It's something that is extremely important to me, and it's so great to see that we've taken steps in the right direction to achieve this. In my case, it took 15 months for me to get diagnosed, which I think is very common amongst the sarcoidosis community. My hope is that by raising awareness of sarcoidosis and through all the advocacy work that the charity does, we can see quicker times to diagnosis and greater knowledge about the disease.
Sarcoidosis does not receive sufficient attention from pharmaceutical companies or medical researchers. Therefore, research into sarcoidosis is limited, but Sarcoidosis UK are changing this. We may be a small charity, but we are one of the world's leading investors into sarcoidosis research and work hard to raise sufficient money to fund at least one major sarcoidosis research project each year. The future of Sarcoidosis UK is really exciting. We're able to help more people than ever before and invest more money into research, but we can't do any of our vital work without your support. We receive no government funding, so are reliant on our incredible fundraisers and your generous donations. Whether you want to take part in an event to raise funds for the charity or make a personal donation, every pound helps us to make a difference to the lives of sarcoidosis patients. With your support, Sarcoidosis UK will continue fighting sarcoidosis and make sure that no one has to go through it alone. Thank you.
Okay, thank you for listening, everyone. I think, Vasilis, we're going to a break now for 10 minutes.
Yes, let's do that. And we will move on to the next session in about 2 minutes.
Perfect. So session 1 will begin at 10:40 and it will be about recently published clinical practice guidelines and be chaired by Professor Wells. Thank you, everyone.